Do modifiers scare you? Or maybe you just don't know when to use them, where to look for them, or which ones to use at a specific time. Well, today was a requested video and I'm going to go through all things modifiers. So I can't go through every last single modifier, but I will try my best to explain to you the different types of modifiers, when to use them, where to look for them, so that you can make sure that you're using the right modifiers when you're sending out a claim. Keep watching. Now we're going to jump into exactly what is a modifier. And I'm going to be reading the definition from the CPT code book. A modifier provides the means to report or indicate that a service or procedure that has been performed has been altered by some specific circumstance, but not changed in its definition or code. Modifiers also enable healthcare professionals to effectively respond to payment policy requirements established by other entities. Now that might have just sound like complete gibberish, especially if you are new to billing or modifiers already confuse you. So let me explain to you what my definition of a modifier is. And if you haven't watched the video about claims that I did where I went through the complete 1500 claim form, please do. But I'm bringing up that because in that video I explained how I believe that a claim tells a story. In order for the payer to pay us, they have to understand what was done, and the claim form does that. It actually tells a story. It lets the payer know who the person is, when it happened, where it happened, what happened. It gives you all the who, what, when, where, why, how, all of the above. And for me, the modifier expands on the what in that story. Now, the modifier is usually two characters. That can be two letters, two numbers, a letter and a number, either one of those combinations, but it's normally a two-digit character. And so you may be wondering, where do you use the modifier? Now, you use the modifier on the claim form, which is what I said, but you also make sure that you use the modifier on the CPT code or the HCPCS code. You do not use a modifier on anything else. You don't put a modifier on a diagnosis code. You don't put a modifier on any of the NPIs or tax ID numbers, none of that. The modifier only goes on the CPT code or the HCPCS code. Who uses modifiers? So modifiers can be used by billers, coders, providers. Now, for me, I believe that it is truly the coder who should be choosing the modifier, especially if you have a coder on board. Now, if you don't have a coder on board, then the next person may be the provider or the biller. Modifiers, though, should be known by all the parties because the provider, the biller, and the coder would understand what's going on and know which ones are right to use and which ones are not right to use. Sometimes people use modifiers just because they know that that will get them paid for that specific service, or they have been taught that way. So let me give you an example. If you use a certain modifier when you are billing for an E&M visit and a procedure code, you, for the most part, might get paid for that visit and that procedure code. But most people who use it are just using it because that's the way they were taught. However, that does not mean that they are correct in using it. So let me just go in a little bit further because I'm jumping a little ahead. Now, there are two types of modifiers that you can use. One is for informational purposes and one is for financial purposes. So let me give you an example of an informational modifier. And the one I'm going to use is Modifier 24. Modifier 24 says it's unrelated evaluation and management service by the same physician or other qualified healthcare professional during a post-operative period. Now, Modifier 24 is telling the payer that the evaluation and management code that you are using it on is during a post-operative period. So it is giving the payer more information. And that is also unrelated to that surgery or that procedure that was actually done. Instead of saying all of those words or writing a note or a letter, if you put modifier 24, they automatically know that that's what you're trying to tell them. You're giving them that extra information. Now, an example of a financial modifier is modifier 52. And modifier 52 is for reduced services. When you put a modifier 52 on a procedure, it is telling the payer that that particular service has been reduced. And then the payer is going to reduce the amount that they pay you, because then you did not do the complete service. You reduced the service for some reason, and so you should not be paid for that complete service. So as you can see, one was for informational purposes and the other was for financial purposes. So where can you find the list of modifiers? Or are people just coming up with modifiers that you don't know where they're coming from? You can find the list of modifiers on the back of the front cover of the CPT book or in Appendix A in the CPT book. And you can also find modifiers in the HCPCS book. And I also believe that's on the covers of the front and the back of the HCPCS book. So we're not just coming up with these modifiers. They are standard and they can be found in the CPT book and they can be found on the HCPCS book. I wanted to remind you about my remote one-on-one services. So if you have any questions about what medical billing is, schooling, taking the tests, CEUs, anything that refers to medical billing, be sure to schedule your remote one-on-one, and I will leave the link on the screen. Now I'm going to be going through the modifier categories that you can find in your CPT book and in your HCPCS book. I'm using my phone, which is where I have my CPT books, my HCPCS books on my phone on Bookshelf. I got Bookshelf through AAPC. That's where I purchased my coding books. So if you ever need those, I can leave the link for those below. But we're going to go through the modifiers. Just look through them, see how many there are, talk about them. So the first ones that you should be seeing here are the level 1 modifiers. And level 1 means the CPT book. So as you can see, there are a few different modifiers. These modifiers are numbers. There are no letters attached to them. They are numbers. Then you have the category 2 modifiers, where category 2 is also in the CPT book. And these are more of performance measure modifiers. Then you have the anesthesia physical status modifiers. And as they say, this is for anesthesia. Then you have the modifiers approved for hospital outpatient use. And this again is level 1, which like we said, level 1 is the CPT book. Some of these are repeat from the ones that we already saw, but there are some that aren't, because some of them specifically pertain to the outpatient. Then you have level 2, which is HCPCS. So level 1 is CPT, level 2 is HCPCS. And this is the HCPCS/national modifiers. As you notice, this has letters and numbers. So you see like the upper left eyelid, you see the right hand, and then you have some that are only letters. So RT meaning right side, LT meaning left side. Then we're going to go through the modifiers on the appendix. Now, if you want to go deeper into understanding what the modifiers mean, then you will go to Appendix A in the CPT book. So we're just going to scroll through that as well. You will notice that they actually go through what each modifier is, kind of help you understand it better. So again, if it confuses you, if you don't really know when to use it because you're just reading the definitions, if you go to the back in the Appendix A, it goes further into how to use them. So this is well more than, I would say, 50, maybe 50 to 70 modifiers, probably even more. If you go through the HCPCS book, which I think I'll run through those as well, you'll notice that there are also modifiers there, and I think there are actually more modifiers. So we're not going to go through every last one, but remember, if you need to see what a modifier means more in depth, you can check out the Appendix A in your CPT. Now let's go over to the HCPCS book, and you will also notice that modifiers are within this book as well. And this is the modifiers in the HCPCS book. They are going over again what we already saw in the CPT book, pretty much the Category 2 modifiers, HCPCS modifiers. But I feel like they have a lot more when it comes to the HCPCS modifiers because, of course, we're in the HCPCS book. So you'll start to notice that there are a lot more HCPCS modifiers in the HCPCS book. As you can see, we just keep going and going and going. Now, if you don't use modifiers in your specialty, or you only use specific certain modifiers, you may not know these modifiers. As for me, I use specific modifiers in specific specialties, like I said, so I know some really well, and there are some that I just have never seen. So as I was doing my research for this, I've noticed that we have so many modifiers. Like I just said, between 50 and 70. That's incorrect. There are way more than 50 or 70 modifiers. So we just keep going and going and going. And we're done there. So there are a ton of categories that you can choose when you are looking at modifiers. I would always suggest that you probably just go through your CPT book, go through your HCPCS book, and just glance over, see what modifiers are there. So if for some reason you need to use them, you can know where to go. And also, of course, you can use Google, and Google will help point you into the right direction when it comes to choosing specific modifiers. I also just wanted to throw in and let you know what Category 2 and Category 3 meant. Now remember, I said Category 1 is in the CPT book, but we also have Category 2 and Category 3. Category 2 are supplemental tracking codes that can be used for performance measures. Then we have Category 3, which are temporary codes. So Category 1 is what we usually use. Those are the regular 5-digit CPT codes. And then you have Category 2, which is supplemental tracking, and Category 3, which is temporary codes. Also remember, if you are in a specific specialty, you may have never used tracking codes. You may have never used Category 3 codes, temporary codes. So just remember to just look in your CPT book to just see what they are, so you can be familiar with where they are, just in case you ever need to use them. Now I'm going to go back into my phone again, and we're going to go through 6 modifiers. Ones that are more common modifiers that most specialties use. And we're going to go through 3 informational and 3 financial modifiers. So the first one is Modifier 25. And Modifier 25 is significant, separately identifiable evaluation and management service by the same physician or other qualified healthcare professional on the same day of the procedure or other service. Modifier 25 is a informational modifier, and most people who do office visits and a procedure use Modifier 25. Modifier 25 has been very controversial because some people use it in the wrong manner, and a lot of the payers are starting to not pay it or request in documents because it's not being used correctly. If you have a office visit and the doctor also does a procedure on the same day, you can use a modifier 25 on the visit. But it has to be used only if it is significantly separate and identifiable. Those are the key terms. And a lot of times providers don't write enough, and it's not significant enough, number one, and it's not separate, so it should not be billed. But 25 modifier is one that most providers may use. Then you have modifier 26. Modifier 26 is the professional component modifier. So, for example, you can use a modifier 26 if you are the provider and let's say you're doing an NST, but the NST belongs to the hospital, the facility, some other person, but you don't own it, but you're reading the report. So you're billing a modifier 26. With a modifier 26, you won't be paid the full amount because now you're not doing both components, because there's a modifier 26 and a modifier TC. And TC meaning technical component. And if you do both, you don't put any modifier. So you get paid for everything, you don't put any modifier. But if you only use one or the other, you're getting paid some of it because you're not doing the full portion. So that's why it is a financial modifier. Then we're going to go to modifier 51. And modifier 51 is a multiple procedures modifier. That's another one that's used, especially, let's say, like in general surgery, or maybe in those specialties where the provider does several different types of services all on the same day. Multiple procedures are not normally paid 100% for all of the procedures done. The procedures may be paid the top one with the highest RVU, may be paid the 100%, and then the rest procedures are maybe paid at 50%, 75%, depending on the payer. So that is another financial modifier because it changes what you get paid as a provider or what the provider gets paid. Then one that is very, very common is modifier 59. And modifier 59 is distinct procedural service. Now this is a modifier a lot like 25 that gets used just to get paid. And it might not actually be a distinct procedure. So if for some reason you have a procedure that is, I don't know, let's say done on the knee and then done maybe close to the knee, and you might try to put a modifier on that one of those procedures saying that it's distinct, but in actuality it may not be distinct. It has to be a distinct service. So most of the time when you're doing a procedure and it is in the same region or you're just using one cut, you cannot bill for both procedures if you're going in the same way. So I hope I'm kind of explaining that right. We've used modifier 59 on, services that the payers may believe are incorporated together or bundled together, but in one of the instances that they are not bundled together, so we have to put a modifier 59 on that because they're distinct from each other. They're not for the same region or the same area, and the payer may put it as if it is, so you might have to put a modifier 59 on that. Modifier 59 can get really tricky. I can tell you up until this point, I still kind of have trouble when it comes to modifier 59, but you also need to make sure that you know about the NCCI edits because those help you determine whether or not you can put a modifier on the procedure codes or not. Sometimes you can't put a modifier on it at all, so it's just bundled together. But I have a video that I spoke about bundling and unbundling. I will link that above to help you understand that if you don't really know what bundling is or the NCCI is. Now we're going to go to modifier 79. And modifier 79 is unrelated procedure or service by the same physician or other qualified healthcare professional during the post-operative period. So that, for an example, could be if a patient had an, I don't know, let's say an abortion, and the abortion code has a post-op period of 90 days. But within that 90 days, the patient had some breast issues and needed to do a biopsy. In order for you to be able to get paid for the biopsy, you would have to put a modifier 79, letting them know that this service on the breast is unrelated to this procedure that the patient had for the pregnancy or for the abortion. It was done during the 90-day post-op period, but it is unrelated to that procedure. This is a different procedure, and it was done by the same provider. The provider should get paid for both procedures because you put a modifier 79 on it. Again, this is more informational because it's just letting the payer know that, yes, we know that there are two procedures being done. We know that the second one is being done within the post-op period. However, the procedures are unrelated. And last, we're going to go to modifier 80. And modifier 80 is assistant surgeon modifier. This modifier is used when a procedure needs an assistant surgeon. So, for example, if a patient has a cesarean delivery, there may be an assistant surgeon. So there's the primary surgeon and then there is the assistant surgeon. Now the assistant surgeon doesn't get paid as much as the primary surgeon because they're basically there to assist the primary surgeon. So they're not getting paid for the full C-section. Now they have to use the same C-section code because they are performing that C-section surgery, but they're not performing the whole thing. So this modifier is a financial modifier because it adjusts the payment that the provider receives. So if you like this video, then you will definitely like this video. So be sure to check it out, and I will see you again in my next video.